So as a healthcare professional, we know that wound preparation is crucial when it comes to wound healing and the management of wounds. But can you explain a little bit more about what wound preparation actually is?
So wound preparation is more of a holistic approach to cleansing and debriding a wound. So you do that holistic assessment of your patient and of their wound, and then you'll do the practical of the cleansing and debridement of that wound. So it's a more of a holistic approach to encompassing both the assessment and the physical body of doing that cleansing and debridement in a wound, bed, edge and peri-wound skin.
So by cleansing and debriding, we're looking at removing debris, devitalised tissue and all the barriers to wound healing that you would necessarily find in a wound, and the wound edge and the peri-wound skin as well, when it comes to cleansing and debridement.
Absolutely, and it's really important that we remember all three aspects of that wound, the wound bed, the wound edge and peri-wound skin, when we do our assessment, but also when we do wound preparation.
So when we're cleansing and debriding, when we're removing the barriers to wound healing, it's also really important to then apply a dressing that's going to be able to help manage that wound and help promote optimal wound healing.
Absolutely. And when you do that wound preparation, your treatment goals or your treatment objectives might change once you've done wound preparation. It might give you a clearer picture of what's going on in that wound bed if you're able to remove some of those barriers and remove or help to remove that risk of infection for that patient. Then we apply the appropriate dressing. We're going to help that patient and their wound to heal much more quickly.
So really simply, if you can remove the barriers to wound healing and remove the barriers to what you can see on the wound bed and the wound edge and the peri-wound skin, it makes it easier to provide that holistic assessment.
Absolutely, absolutely.